Hello, I'm Michelle Jorgensen with the Mount Mahogany Steak Self-Reliance videos. Today we're going to talk about first aid. Now, sometimes when you start talking about first aid, people become real overwhelmed real fast because they think, all right, I don't know how to take care of things that are problems in a disaster. I don't have the necessary supplies to do it. So we're going to simplify it down for you today, and we're going to make some real simple goals to start with. So the two things you need to consider having and preparation. Number one, you need to have skills. And number two, you need to have supplies. So let's talk about what the basics are in both of those categories. So the first thing is skills. So CPR has changed a lot in the recent times, but you know what? If you learned it 5 years ago and you still remember it, go for it, it's great. But I would suggest getting a recent certification for that. You know, you don't even need a certification, you don't need a card that says that you've learned it, just learn it somehow. Even if you go online and watch YouTube and just learn CPR. It won't necessarily save every life, but it will make you feel more prepared if you do have an emergency on your hands. And this doesn't have to be a large emergency or disaster type of emergency. This could be just something that happens, you know, in your life with one of your family members. So CPR is a great skill to have. The second one is choking. I think most everybody's fairly familiar with the Heimlich maneuver and what you would do. Actually, we just had an incident of this when we were on trek. One of the other food committee members has a problem sometimes with his throat closing off, and he actually started choking on some watermelon. And so one of the other men on the committee started, you know, doing the Heimlich maneuver, and it wasn't working. And so everybody was all gathering around, and one of the women started yelling, "Higher, higher, higher!" And so he, you know, moved his hands up higher, and sure enough, there he went, and out came the watermelon. So it's something you hopefully don't have to ever use, but it's worth knowing how, and it's worth knowing exactly maybe where that placement should be. Bleeding. Okay, bleeding scares people, but it doesn't have to. So the main thing to stop bleeding is pressure. You need to put direct pressure on the area of bleeding for at least 20 minutes. So don't lift it up, don't check to see if it's stopped, don't do that. Direct pressure for 20 minutes and leave it there. If you still have bleeding, then find the artery that's feeding that bleeding area and put pressure there. Now, a key to think about this is veins are the things you can see. So, you know, if anything I can see here, that's going to be a vein. That's not going to do a lot of good for me. I need to find the artery that's feeding that. Typically, the artery is going to be deeper. So you're going to need to put a little deeper pressure. You're going to have to push a little harder because the arteries are deeper down and you're not going to find them on just the surface. Those are veins. So you're going to have to push a little bit harder to find that artery and to close that off. Burns. Okay, I had an incident. We were at a family get-together for a few days, and one of my little nephews, well, one of the other nieces and nephews had turned on the propane fireplace, and nobody knew. And I guess this fireplace heated up on the outside of the fireplace. And so my other little nephew came by, pushed his hand against the fireplace, and it burned his hand quite badly. So what I did at that time, and what I learned at that time actually, is, you know, we think that you should just put a little bit of ice, you should just put a little bit of something on it. That's not true. You need to have cold running water on that for at least 20 to 30 minutes. What that water is doing is it's actually stopping the burn. Literally, it's stopping the burn because that burn will continue into the deeper layers of the tissue. So you need to have cold running water on that for 20 to 30 minutes. Don't take your hand out of it. And it was interesting because my little nephew, he was probably only about 4 at the time, he wouldn't take his hand out of it. He kept his hand in that water for about 4 hours because it felt better when it was in that water. And you know, it doesn't have to necessarily be running as long as you keep it cold. We threw some ice cubes in a bowl with a bowl full of water, and it kept it real cool. So, and you need to do it for an extended period of time. Fractures. Okay, how do you take care of fractures? Well, I had a real interesting course, and this probably is a good thing to describe at this time too. I took an emergency life-saving course, and what they did is they taught us what we would do in any kind of a real emergency, even an active shooter emergency, and then they simulated these emergencies. So we had to actually go into an active shooter environment, find the injured, find the shooter, disarm them. This was a crazy class that we took. I had my boys take it with me. But we learned that a lot of times there's things just in your environment that you can use to take care of medical emergencies. So for fractures, cardboard box. You fold it up, you wrap it around that fractured thing, you wrap it around with a belt or a tie or something like that, a hair tie, and you can keep it at place. Because the main thing with fractures is immobilization. You just want to hold it still because it hurts a lot when it moves in that fracture. So use anything that's close by. Tourniquets, a tie, again, a hair tie, a belt, all those kinds of things. Even, you know, clothing wrapped real tightly will work as a tourniquet. This is something I got from that class, which is a tourniquet inside of here. And I carry it in my purse all the time with a CPR kit and some latex gloves, just in case I ever run across an active shooter. Now I know what to do. CERT training, that's the one that I really, if you have the time and you have the inclination, I would do it. CERT training is a community emergency response team or training, and what it's going to teach you is how to handle an emergency, a large-scale emergency. So it's great training, and you'll learn a lot in that. All right, so that's the skills. Now let's talk about the supplies. So I have a couple different kinds of first aid kits, so I'm going to talk you through a few of them. This one is a small and simple first aid kit that I keep in my purse at all times. I've used this so many times, that's why it looks a little raggedy, because I've used it a lot. The basics are Band-Aids. What mom doesn't need a Band-Aid? You know, some ibuprofen, some just medications you might use all the time, some larger Band-Aids with some tape to hold it in place. I've used that actually quite a bit, and some gloves, just to keep yourself safe. So those are all things to keep in just a purse, just to have on hand anytime you might need an emergency when you're out and about. And like I said, I've used this countless times. Can't even tell you how many times I've used this little first aid kit in my purse. Excuse me. The next layer, the first aid kit that I want you to talk about, is the one that I want you to set your goal for this month. So this is just a small first aid kit. I actually used this. I was the medical person on a trip recently, and so I put this together, and I've just used it since. I've taken this many, many times since that time. So it's just some basic things, and these are things that you just buy at Walmart, okay? You know, Walmart, Target, whatever. It's just some bandage material, antiseptic wipes. It has a nice knife in there, some alcohol wipes, so that you could take care of a laceration, of a cut, of something like that fairly easily. Bug spray, bug bite lotion, some muscle relaxant magnesium lotion, just some miscellaneous things like this that you always think, gosh, I know I have that somewhere. Where is it? Well, now you know where it is. It's right here in your kit. So you can have it all together. Wet wipes. You know, who doesn't use a wet wipe when you have something going on? Some Band-Aids. Obviously, those Band-Aids have seen a better day. And then just some basic medications. Basic medications so you can find them quickly and easily if you need them. So this is the goal for this month, is I want you to create a small first aid kit that you can have for your home, that you can easily pull out and easily get to. The other thing that I have in this first aid kit is a first aid manual. So if I really had something more than just somebody cut their finger or sprained their finger, or had a bad mosquito bite, I would have a ready-made reference that I could just open real quick to find how should I handle that. Just a little bit of peace of mind. So that's a real small kit that you can make. That's your goal for this month, is I want you to do that. The other thing I want you to do is I want you to just store some basic supplies. Vitamin C is one of those things that if you have this, it will help you get through a lot of problems because it will build your body's immunity. In any kind of a disaster situation, that will be extremely stressful. Stress taxes our bodies. We need a little bit of help to stay healthy during those times. So vitamin C, I store multivitamins, things like that, just so if we ever were to have an emergency, we would have the things we would need to keep us healthy and happy. Now, these are if you actually have a little bit more medical training, a little bit more specialty training in some other way. I'm a dentist, so this is my dental kit. So if there were anything that were ever to happen, I would have everything necessary to pull a tooth, to fill a tooth, to take care of a broken tooth. I have anesthetic in here. I have whatever I would need if something were to happen in a dental way. And I even have, things like gloves and cold packs and things so that I could take care of any dental needs. If you have specialty training of some way, please prepare some kind of a pack for yourself, because your training really isn't very useful unless you have the supplies that go along with the training. So make sure you have some kind of pack prepared. Because I have dental training, I also have maybe a little bit more medical training than most. So this is also my medical first aid kit. And I have all kinds of things in here, from slings to splints. If you have a gunshot wound, I can take care of you. All kinds of really cool things like that in here. Stethoscope, and I've always wanted one of these, but as a dentist, you don't get to use those very often. So, if you have some extra training, or if you just have a little bit of extra need, prepare one of these kits for you. See, this is something, if somebody's really bleeding and a gun hit them, I'd be able to take care of you now. So, these are things you can piece together, you know, a little bit at a time. A little bit here, a little bit there. You go to Target, you grab an extra bottle of ibuprofen. You grab, you know, just a little here, a little there. Whatever your training is, if you have training in alternative medicine, please have a little storage of essential oils, of herbs, I actually have a whole big storage of herbs and those kinds of things, because that actually probably will be the medicine when this is depleted. That's the medicine that we're all going to have to go to. So learn some skills and prepare some supplies. That's this month. If I have to pick, my top things that I would have on hand would be Band-Aids. What kid doesn't feel better with a Band-Aid? Antibiotic ointment, because there are going to be lots of bugs and germs that we're not used to dealing with. A manual, some kind of a book that you can use if you have questions, and then medications. What I did notice on medications, I actually just had a wonderful cold sore because of Trek, and I thought, you know what? I think I have some antiviral medication down in my storage. Sure enough, I did. I had a big old bottle. Unfortunately, it expired in 2016, and it's 2017. It still kind of worked, I think. So make sure also if you have some medications that you're rotating them, because they actually expire. I have no idea when this vitamin C expires, but hopefully it would still be potent if I needed to use it. So that is the goal for this month, is I want you to create a small kit of some kind that you can use in your home, and I want you to store some basic supplies according to your training. So you have supplies that will support whatever level of training you have received in medical care of any variety. So that is this month. Thanks so much for watching.